Maps will come to tell you about the near west side, filled with culture and Latinx pride. Although plagued with those who try to gentrify, we won't stand down and let them divide. It's filled with lights and brights and kites flying. High above Pilsen, these dreams are undefined. Our voices will be heard, there is no denying. No more silence in the gun violence.
This summer, our team of college and high school student researchers with MapScore and El Instituto de Progresso Latino studied how violence and mental health affects the near west side.
The Near West Side is a diverse community home to a large Latinx population. The area experienced similar rates of violent crimes when compared to similar community areas with higher rates of behavior related to hospitalizations and deaths. According to Erica Goddardson from WTTW, the recent high-profile deaths in the community, such as the 13-year-old Adam Toledo, have deeply impacted residents, and particularly Latinx youth who are facing a mental health crisis.
Our research question is, what changes need to be made to the mental health resources in the near west side to help the community heal from trauma of violence? Our hypothesis was properly funded, easily accessible, and culturally relevant mental health resources have the potential to help the near west side appropriately heal from past traumatic experiences.
Compared to Lakeview, a community with the lowest rate of violent crimes in Chicago up north, it is shown that the near west side has a lower amount of mental health resources and higher rates of violence. The living expenses in Lakeview are also higher, but staying safe in Chicago should not be determined by the area you live in and its living costs. The near west side is similar to Brighton Park, another community nearby, with its high rates of violence and drug use.
In the past, the Near West Side hasn't received healthcare resources or awareness shown through the Illinois Department of Healthcare Transformation Collaboratives. Recent efforts are being made to get improved treatment, such as implementing more mental health clinics and funding, according to West Side United. In 2018, Chicago Health Atlas revealed that the social vulnerability rate was 55.22. This rate identified those communities that are especially at risk in case of a hazardous event such as global pandemics.
Health Affairs states that violence is linked to having adverse consequences on one's mental health. According to the Chicago Create Real Economy Destiny, although shootings have significantly dropped in the West Side neighborhoods this year, residents are still processing their trauma of the recent high-profile deaths in the community. Studies show that lower numbers of mental health clinics directly impact the safety of the public by making help inaccessible to those who need it the most. According to the National Center for Biotechnology Information, paying greater attention to diagnosing and managing concurrent substance abuse disorders can be a potential violence prevention strategy.
Studies show that lower numbers of mental health clinics directly impact the safety of the public by making help inaccessible to those who need it the most. According to the National Center for Biotechnology Information, paying greater attention to diagnosing and managing concurrent substance abuse disorders can be a potential violence prevention strategy. The NBCI states minorities are underdiagnosed due to structural factors linked to health disparities, such as less access to mental health care and service use amongst Black and Hispanics compared to whites, high unmet mental health needs among Latino children, and more stigma-related concerns about mental health care among women of ethnic minorities. This data suggests white people are diagnosed with mental illness more than minorities. This is because mental illness in white populations is more acknowledged due to easier access to mental health services. Minorities are underdiagnosed, which misrepresents their struggle by undercounting their issues. These inaccuracies make it harder for help to be allocated.
Crime rates daily in America have left full public clinics in Chicago, leaving many residents without mental health resources nearby. In Mayor's Life for the 2022 Mental Health Equity Proposal, she plans creating quality care and establishing mental health clinics and nonprofits, which the Near West Side lacks. In the 405 Illinois Compliance Statutes 5 plan, residents have access to allocate towards mental health services. In our own community survey we conducted, our survey indicated that 82% of the Near West Side residents have stated that they want more resources related to mental health. Through survey data we collected in the Near West Side, we found that many long-term residents of the community are in favor of dedicating more resources to improving mental health resources. We also found that many residents of the Near West Side believe that there was a connection between the level of violence in the community and its overall mental well-being. Although there may be assets that offer mental health resources, many residents are not aware of them or cannot afford it. We hope to open up Mayor's Life proposal for discussion to reopen local government-funded clinics for residents with allocated funds towards mental health through the city's Trauma-Informed Centers of Care program. In this implementation of the Trauma-Informed Centers of Care, we demand that the City of Chicago keep in mind its large Latinx population and the Near and Lower West Side by spreading information through different mediums such as flyers, posters, and social media that can be understood by the diverse residents through culturally appropriate languages and images.
In times of crisis such as the pandemics can lead to a lack of resources. We are demanding the City of Chicago to create a positive impact using the local assistance and tribal consistency funding to create more mental health clinics in the Near West Side and currently vacant lots and abandoned buildings so residents are mentally healthy and the community has a source that will decrease in violence. According to the Case of Family Foundation, 13% of adults reported new or increased substance use due to coronavirus-related stress, and 11% of adults reported thoughts of suicide in the past 30 years. The Chicago Sun-Times showed that each year violence is gradually increasing.
Using old abandoned buildings and vacant lots to create health clinics can help to provide support to residents when asking help in addition to increasing clinics. We ask that the city prioritize hiring more Black and brown personnel in these spaces. According to the Substance Abuse and Mental Health Service Administration, hiring Black and brown personnel to be involved in these facilities will create more comfortable, culturally relevant, and safe environment.
I'd like to thank everyone at MAPS Corps, El Instituto de Progresso Latino, and the community of the Near West Side for their support over the summer. As we conclude, we ask that you continue to keep those that have been lost as a result of violence and lack of equitable healthcare in your thoughts. Thank you.